Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my latest video. So for a patient who attended reporting a symptom known as occlusion. So occlusion is whereby you have a sensation of your internal respiratory sounds all trapped inside your head. It's almost like you're in a bubble. And earwax can cause that. So the eardrum works both ways. It allows external sounds in the environment to enter through the eardrum, through the middle ear to the inner ear where the organ of hearing is, but it also allows internal sounds to escape. So it's a two-way door, the eardrum. Now, if your eardrum is blocked and you've got wax or a catarrh behind the eardrum glue ear, it's not going to allow external sounds to enter. So instead of going through the eardrum, it's going to hit the eardrum and reflect back out of the ear. But on the same note, it's not going to allow internal sounds, so respiratory sounds, even your own voice, we call that otophony, to escape. So it gets amplified, trapped in your head. You can actually just test that yourself. You've just put your finger on the cartilage, on your tragus, and push that up against the entrance of your ear. So you shut your ear canal. You should be able to hear yourself a lot louder inside your head. And that's called occlusion. And that was the patient's main symptom. They also, you would notice it's really wet, and so they've been putting drops in, you can tell that. Now, not really the patient's fault, because I've been reading the instructions for a lot of these ear drops. They don't advise you accordingly, I don't feel. When you put drops in, you tilt your head to the side, so the ear that you're putting the drops in is facing the ceiling, and you should let it soak for about 5 minutes. And then what you should be doing is actually tilting your head the opposite direction. So you want to drain your ear of the drops. Otherwise, what will happen is that the drops will just seep down your ear. It will collect on your eardrum. You've got your inferior recess about 0.5 centimetre away from the eardrum. It can collect in a puddle there. But also any wax that you've got in your ear, you're going to soften the wax with the drops. And this wax is just going to slide further down the ear canal towards the eardrum. Whereas really what you want to do is drain your ear. So as the oil comes out, you're hoping that some of the wax comes out with it. So we've got the majority of the occlusion removed, just some dead skin superiorly. I'm just hovering over the dead wet skin. If it comes off, brilliant. If not, we're just going to leave it there, because we don't want to cause any trauma or abrasion. Cut the skin that lines the ear canal, because that then will open up the ear canal to infection, make it more susceptible. Again, just on the opposite side of the anterior superior canal wall, probably mid canal, so we are on the bony part. I've just bent the fine end gauge slightly so to get the angle. I'm just hovering over. If it comes off, brilliant. If not, it's not a problem. And there's the patient's eardrums, fully visible. You would have seen we've got that big lump of wet wax. Just a bit. You can see a bit of drops there that's collected in the inferior recess. It's like a basin. So at the bottom of the eardrum, you've got like a sink, a basin. We call that the inferior recess. So now it probably would drain by itself. It's not going to cause patient much symptoms, but patient was very still, had a fantastic view. Just bent the fine end. You can see the curvature. Just bent it to get around the anterior canal wall. Just hovering over there. Just see we just mop this bit of drops that's collected in this basin, the inferior recess, and lovely healthy eardrum. Hope you enjoyed that video, guys. Take care.